Hello, everyone.
Hello, everyone. Thanks for joining us for our 2021 Fall into Beauty event. Um, I think we're following two wonderful talks by our team. Colleen, Deanna gave an outstanding talk. I learned a bunch for the little that I could see. And then I know our nurse and PA team just finished up the Beyond the Needle talk, and we're going to get right into it. This is an interesting talk. I think it's on a lot of people's minds for people that are considering surgery. And the talk is titled Fearless Beauty and taking the fear out of that cosmetic decision-making process, which is a big decision for many, as it should be. So I'll let Dr. Lieberman take it away.
And then we have a special guest coming to join us too at some point.
Yes. Before he starts, sorry about that. The question and answer. So you can drop your question and answers up in the top of your screen. You'll see an icon. I think it says questions, but there's a little graphic that shows you where to do it if you're on a mobile phone. Please feel free to ask any questions you want. This is a great opportunity to get answers out of us, especially because I know sometimes our time in consults or getting to us in the office is limited. Next. So a little bit about us. Thanks for putting that slide together, Izzy. Dave and I are both facial plastic surgeons, dual board certified, really love what we do and enhancing people's lives, taking our skill, perfecting our craft, and having the opportunity to be a part of this wonderful team and teach.
Okay, so the motivation behind this talk is we love talking and educating about facial aesthetic surgery and facial plastic surgery and reconstructive surgery in general. But we thought it might be helpful to focus a little bit about what role fear plays in the cosmetic surgery decision-making process. And I want to preface this by saying I think fear is a natural part of this. I think anytime we make a decision, especially when it comes to surgery, it is normal to have fear. And I think what you can ask of us is what are we doing to sort of mitigate that fear? I don't know if it's possible to get the slides up for us more. Yeah.
Thank you.
Great. Thanks. That's great. So let's just start with how somebody makes a cosmetic decision. I think the first part is interest. You have to be interested in doing something in the aesthetic world. And then the question that is very important is it externally motivated or internally motivated? What I mean is this something that comes from you, where it's a desire, something that's bothered you, something that you feel motivated or empowered to do, or is it something that somebody mentioned to you, or you saw on an Instagram filter, or there's some sort of external pressure that's pushing you to do it? If it's an external pressure, it's really not coming from a healthy place. And really, if it's internally motivated, that's where the foundation for having a successful outcomes comes from, is that it comes from you, it comes from the right place, realistic expectations, healthy desires to make an adjustment. And then the other question is it an impulse, or is it intentional or thoughtful? These are big decisions. We take them very seriously. And we often take them, encourage people to take more time to think about doing something. This shouldn't be impulsive. It should be something that feels right, that's kind of come through an evolution of thinking. And then the next step is identifying the right practice. And obviously there's a lot of different ways to do that, but you're going to do research. I think word of mouth is a powerful tool. But there's obviously a lot of credentialing that should go with that when you make that choice. And then the next step is the education phase. So you've identified some practices that might be a good fit for you, and you're coming at this with healthy goals and desires. And then you start the education phase. And I think this is the most important and sort of empowering phase for patients. We spend quite a bit of time talking to people about each and every procedure that we do that's available, pros, cons, limitations, expectations. I think you should also spend time on your own learning about things, what makes sense, what's going to be the best fit for you. Um, and then you find a treatment pathway. And so, you say, okay, well, here are the things that I want to address. And these are the options in front of me. And then I think this is where the fear filter kind of kicks in. And what I mean by that is that we see a pathway in front of us, but there are a lot of fears and concerns that can really alter that treatment course and really guide people away or towards various decisions. And I think, just to take a second about the fear filter, a little mental exercise. So, I for people who are watching this, think of something in the facial plastic surgery world that you've considered addressing. That can be
Non-surgical or surgical.
surgical. It can be nose, it can be an eyelid, it can be neck, it can be skincare, laser, anything like that. And then imagine, forget about any other influence. Imagine the outcome you want to achieve and the procedure that you think probably will get you there quickest or achieve that kind of maximal outcome. And, sort of think of that treatment in mind. Might be a BOTOX for a wrinkle, could be a rhinoplasty for a nasal concern, or a face and neck lift for neck stuff. And then think about, okay, so what's standing in the way? And I think you can divide these things into logistical concerns. That could be timing, work, other things, or it could be fear. And fear could be, I'm worried that the outcome isn't going to be what I expected. I'm worried about anesthesia. I saw someone looking strange out at the restaurant the other night, and I think that could happen to me. These are really normal, but, I think a lot of that is fear that then influences our decision. Next slide. Thanks. So, I think for us, logistical obstacles can often be managed with logistical solutions. If it's a timing issue, then it's about finding the right time. It's about, figuring out how to create that space. Obviously, Zoom and everything has created a lot more flexibility in aesthetics. But if it's fear that's getting in the way of making a decision, then I think we have to do our part to try and really eliminate some of those fear concerns that is influencing, patient's decision. So the next step is just sort of what our commitment is to trying to reduce that fear in decision making.
So how, one of the things we stand by, or what we can do as a practice to remove that fear, is instill fundamental tenets that, push forward education, making sure that patients get the right education, the right information, but ultimately we want to do what's best for the patient. And we try to, practice every day, living by some of those words that you saw, those three words that you saw on that slide: expertise, humility, and excellence. And those three words are important to us individually, to our whole team. And what they mean is, we take it upon ourselves, our entire team, not just us, but every step in that process, to become expert in what we are doing. Whether it's the surgery that we're performing, the stitch that we're throwing, understandings, the settings of the halo that's being performed, every single step, every single person in our practice is accountable, and we want to make sure that they're expert in what they're doing. And what that requires, though, is humility. Kind of understanding that you may never be expert. There's always this unreachable goal, and that growth mindset is important. And having that humility to know that you can achieve a better outcome for your patients. And then striving for excellence in everything that you do. You get the knowledge, be humble about that knowledge, know that there's more to seek, and then excelling in the craft that you're performing. So that's, I think, really important when it comes to how we can take that fear filter and alter it. You go to the next slide, Izzy. So in terms of expertise, as our practice is hyper specialized in the face, whether it's skincare, energy, light, laser, injectables, neuromodulators, or surgery. We're super specialized. We have a very, very unique and critical understanding of the face. And, repetition makes a difference. Dave and I have been at it now close to 10 years, and we've been fine-tuning our results. We've been fine-tuning our methods and our techniques, always searching for what's best. And we're going to be slow to adopt new technologies because we're looking out for our patients, but we also don't want to take the next best hot thing and say, okay, let's just offer it to everyone because it's the newest thing. We really take time critically evaluating what is going to be the right tool to supplement our patients' treatment options. And we think about this a lot. There's value in saying no to certain procedures. And what we mean by that is that we've never particularly regretted turning a patient down or advising a patient that this surgery might not be in their best interest. I don't think that's ever happened to either of us. And there's importance in making sure that we feel like we're guiding you in the right direction. And when the goals or the expectations aren't aligned, it's important for your provider, surgeon, nurse, PA, esthetician, to kind of guide you in the right path. And there's value to saying no. And I think that's important. And a mentor of ours has always told us, it's very easy to figure out who you're going to operate on, but it's a much more important skill to figure out how you filter and who you may not operate on, or at least come up with a customized plan that they might not have realized is the best for them. Next slide. So another thing that's important in our practice, and I know you guys have met some of our team members tonight, is we take a lot of pride in the hiring process and bringing on excellent team members that can augment what we offer here at L&P Aesthetics and have their own areas of special expertise. Our staff is highly trained, and we're not a place where we incentivize them by quantity. They're incentivized to provide the highest level of patient care, and only that. To look out for your best interest, not by amount that we're doing or what we're doing, but really it comes down to making sure that your best interest is in mind. And the hiring process here is very important to us. Every team member we bring on spends quite a bit of time before they're even brought onto the team, especially our providers. And I think you've seen that just from some of the talks tonight. Next slide. So we're going to get into the next part of our talk, which is kind of going through some cases. I'll take you through some cases. We've kind of broken these down into lower face and neck concerns, area of concerns around the eye, some skin concerns, and then some nice results from nasal surgery. So this is her first case. We'll talk to this patient. Many of you know her well. And should we just go to the pictures and then talk to her, or just spend time on theirs? Okay. You can. We have a special guest, and you want to come right? You want you to come in the middle right here.
Hey everyone.
We'll adjust our camera so we can ask the question. Perfect.
So this is Yolanda. Yolanda has been with us, more or less since the beginning, and obviously plays an incredibly central role in this practice life, in our lives, and in a lot of your guys' life. And I think it's been helpful for a lot of people to talk to her and pick her brain about her experience, because she looks at this world, this aesthetic world, through a similar lens as a lot of people that are interested in these services. And she's made decisions along the way. I mean, from say 30s into her 40s, that will feel familiar. If you guys follow us on social media, you know that she was nice enough to let us post some of her kind of healing photos and before and afters. And she is now how long?
4 months.
4 months after our kind of signature lift, which is a deep plain face and neck lift. So I wanted to ask you,
Okay.
You've been with us for many years, but you also were kind of interested in aesthetics before you joined us. When 10 years ago, when you were looking out on the world of facial cosmetics, what were the things that bothered you, that you prioritized, and what did you do about it that you feel positive about? And are there any things that you regret doing or that you were afraid to do, 10 years ago?
Sure. So I think in thinking back, 10 years ago, I never thought I'd be here talking about a deep plane facelift on me. I really didn't. So at that point, I was thinking medical grade skincare, BOTOX, and anything non-surgical. So I did all therapy. I've done Halo BBL, all great treatments at the time. It was small, impactful changes, but not surgical. I love the results, but I'm 50 in a couple of weeks. And, I would say a few years ago, I started thinking, I think I'll be ready for surgery. And the reason behind that was because of the gelling or the laxity in my neck, the things that I was doing weren't enough for me. Like I wanted just a bigger change. And as I aged, I realized that there wasn't anything non-surgical that was going to treat my crepey skin in my neck. And don't get me wrong, I've tried everything, and it gives you a little lift. It absolutely does. But it wasn't like your facelifts that I was seeing day in and day out.
So I think, something that we've heard a lot, or I think that you've heard a lot, is it was sort of surprising that you did it because, you're a very beautiful person, and a lot of people think, it wouldn't be someone that people would think would choose to do it or would need it, and I think there are cases, and we talk about this a lot, of people with certain types of laxity that's not due to sort of a fat or laxity just in the neck, where there's that sort of thinner skin laxity, a little bit of descent to the soft tissue, the mid-face and the lower face, where non-surgical modalities, heat-based modalities, are not going to give the kind of outcome that a lot of people expect. But you had been talking a little bit about that stuff for a couple of years leading up to this, right?
Sure.
And
Probably even a little bit before that. It was just more I was afraid to take that next step.
Right. And so this is where, this whole fear filter comes in, where I think it is really normal to be afraid to take the next step. And it's not to say, well, forget about your fears and just do anything whenever you want it. I think there's value in waiting until it just clicks and you say, okay, this is my time. And I think we've seen, in the last 5 years, younger and younger patients proceeding with surgical treatments and sort of foregoing non-surgical. But there are many people who say, it's just not my time. I'm just not ready to do that. But I think, and correct me if I'm wrong.
Sure.
Now that you've kind of gone through it, it's checked more boxes than some of the other modalities that you tried.
Absolutely. I think, if I could just, there's one thing that I think every patient, don't show my pictures.
They've been up the whole time.
I know. I don't like looking at them anymore.
We can go to the next slide now that we talked about our surgery.
I think the one question or the one thing that always comes in people's mind, including myself, and I know they'll laugh at me, but you always think, oh my gosh, but am I going to look good? Or am I going to look weird? Or am I going to look different? The reality is that family members, friends, they thought I already looked like this, which, clearly I didn't. And there are, mind's eye, I had a sharp, neckline, and I had no sagging or laxity in my neck. So honestly, that was one of the fears. I obviously trust both doctors 150%. But you still have that go through your mind. And, I see people day in and day out, with that fear, but I also see people coming in and out of our practice, looking just refreshed. And I think that's one of the mysteries, or one of the things that people don't get to see, that obviously I get to see being the practice manager, is that I know that's a fear, but I also know it's not true.
What would you say, because people struggle obviously with this decision, what would you say was one of the hardest parts about going through surgery? Because,
Sure.
it is surgery. We don't want to paint this picture like it's something that you do at lunch and you're fine. You do it on Friday and you're fine on Monday. So what was one of the hardest parts? And then what has been, you're in that sweet spot now, 4 months. You should we have find that between 2 and 3 months is when people really start to fall into that beauty that after their procedure. What was one of the best things that you feel like came from this?
So I'll answer that question first because I get excited about that. So there's something that happens, and I don't understand what, but there's something that happens in your brain that just, you're so thankful that you've kind of turned back the clock or treated the areas that you tend to focus on when you start to age, that you no longer think about that. And you start thinking about how to take care of yourself and your body, just your overall health. I think I've taken a turn in ensuring that, you've helped me with this.
Yeah.
And now I'm making the extra effort to eat better, to exercise. I didn't realize that would happen, but instinctually it just does. I hate to say that I'm happier because of it, but I can't help it. I am. It makes you feel good. It makes you feel confident. And I've never thought I was a person that didn't have confidence, but it added that little extra oomph.
Yeah.
Yeah, I mean, I think the word empowerment always seems to come up. I mean, I sort of feel like it's something you did for yourself, and you can see it. I mean, we've known you for a long time now.
Yeah.
There's definitely a certain kind of way that you're presenting and holding yourself in confidence level. And I mean,
It happens.
I think
Good.
you've always, So anyways, let's go to the next
So,
slide,
yeah,
though,
let me
so
just
we can just
answer
show.
Wait, there's one more. I want to just.
I know, I want to show the.
Oh, yeah.
That's me.
Here's the big, I guess, yes. Go ahead.
Before and after, it's at 3-ish months.
Yeah, so just to talk about this, what we're kind of seeing, are you okay?
Yeah, absolutely.
I think one of the benefits of the lift we do is that it's not just about defining a neckline or a jawline, but it's really about release of the soft tissue of the kind of low cheek, moving all the way down in this kind of parentheses from the low cheek to the jowl to the neck, because that really is a single unit. And once it's released as a unit, then our job is just to kind of let it be resuspended back where it came from, right? You're never moving tissue in a new direction. You're only replacing something back where it came from. And if you stick to those principles, you tend to get really natural looking outcomes. Obviously, a sharp looking jawline is important, but a sharp looking jawline can also look unnatural. And there's a real subtle difference between something that looks natural and youthful and appropriate and versus something that looks, too snug or tight. So I think, for me, when I look at that photo, and a lot of what I see is the volume down in the front of the face, kind of by the mouth where the cheeks are, and how when that gets lifted and repositioned in the right way, then it looks really, pretty and soft, even though things are sharp, underneath the jawline. Sorry, I cut you off, Sandra.
No, it's okay. And then I would just comment on, Dave and I spend a lot of time trying to achieve that neckline and angle. We talk a lot about creating depth or shadows between the jawline and the neck. And you can see that captured, especially kind of toward the back of Yoli's jawline. There's kind of a shadow so that the jaw and the neck are at different depths. So there's a more three-dimensional shadow there. And then, of course, that 90-degree neckline that you're seeing right under her chin. She talked a lot about eating healthy. It does look like, I haven't seen these pictures in a while, but you can see that she looks healthier. She looks, obviously more youthful, but it looks like you lost some weight too.
I did lose some weight.
There are a lot of questions, but I guess we'll do them at the end.
Yeah, we should probably get going to them. So here are just some, there are some questions for you.
Okay.
Let's pull this, we got to pull a little closer because I can't see that far. But here are a couple cases. This wonderful patient of ours, many of you have seen maybe before. She's she holds a very special place in our hearts. But she had a full facial rejuvenation from hairline down to clavicle, upper and lower eyelid surgery, brow lift, volumization with fat transfer, and a deep plane facelift and neck lift with some skin resurfacing. We'll get to TRL laser in a second. I know there were some questions in the last session that were more pertinent for Dave and I.
She was 72 when we did it.
Next is, go ahead, Dave.
So this is a great patient. She sent us a selfie back from her travels a while ago. But really youthful patient, kind of same sort of category in some ways as Yoli. But we did a little bit of upper eyelid surgery, some chin strengthening, shortened the upper lip too, and then did our face and neck lift. So again, this is, I think we're starting by just with what we do a lot of, which are these kind of multi-procedure combinations that include our deep plane face and neck lift.
She also had it. Did you mention the chin?
Mm-hmm.
Okay. And then, of course, there's a wow of a difference. Full facial rejuvenation, laser resurfacing. You can see that soft slope to the chin and how the chin projecting it forward really allows you to get a nice deep 90-degree neckline. And then she had some lip shortening as well. Go to the next slide. We'll whip through these now pretty quickly. Go ahead, Dave.
So I missed this patient. I haven't seen her. This is a great outcome. This surgery came at a time in this person's life where she had a significant weight loss, and I think we're both quite proud of this result. There was no resurfacing done, and I also think it's a result where there still are some signs of facial aging. And I actually, when I do consultations, I often use this photo to say, there's no magic erasers, right? You want to achieve a really robust change, but it's not about, if I just pull a little tighter, will that look a little better? You want to understand that not every single line can be erased, and that's okay. Obviously we do our best to kind of get the best outcome possible, but in a case like this, if you look at the after, there still are some signs of aging, but obviously the transformation is pretty significant.
This is also a full facial rejuvenation. This patient had her upper and lower eyelids worked on. Fat was transferred to her face so that we take the volume from the belly or the thighs, process, purify that fat, and bring it to the face to add volume to kind of create a more youthful, heart-shaped or inverted triangle appearance. And then she had a lip shortening as well. What I love about this picture in particular is just the sharpness of the jawline that you're seeing. You can see there's a difference between where the jaw starts and stops and the neck starts and stops. Someone had a good question. Does a deep plane facelift refer to the lower face and neck? It does. The word facelift is a little bit misleading. It's not the entire face. There are 3 areas that are addressed in a deep plane facelift and neck lift. It's the neck, it's the jowl area, which is along the jawline, and it's that mid-facial area right adjacent to your smile line or nasal labial fold. That's the 3 areas. So it's all below the lower eyelid.
So transitioning away from face and neck lift surgery, this is a patient that was concerned. She had some nasal concerns, but in this photo, it's mostly looking at the eyes. And we did upper and lower eyelid surgery, and also did a little bit of fat transfer in the lower eyelids, and then used the TRL laser, which is a fully ablative erbium laser, which I think we're going to talk about because there was a question about it, to help resurface some of the skin around the eyes. Just to take a quick second to talk about lower eyelids. This is obviously, it's a really common concern, and from an education standpoint, when someone says their lower eyelids bother them, it's usually not just right here. Often involves this kind of general area in the lower eyelids and the transition to the cheek. And we always talk about— I
don't think they can see because we're like little small boxes to them.
Well, so
yeah. You got to describe it. No, now you can see
it. The lower eyelid is where you can get some fat pooching out. People call it, lower eyelid bags. But then there's often a shadow or a hollowing underneath that, and then there's also some skin issues, whether there be excess skin or textural changes in the skin. And so the photos we're going to show you, a lot of them combine 1, 2, or 3 treatments. The lower eyelid surgery alone, which is contouring the excess fat of the bag, and that can be either removal or transposing it to a new location. Sometimes adding fat, so taking fat from the belly or the legs and putting a kind of conservative amount of fat to help with the transition from the lower eyelids down to the cheek. Obviously this is never about huge volume. It's just about a soft transition to add volume where we've lost it. And then something with the skin, whether that be skin removal or skin resurfacing. And in this particular case, the lower eyelids were treated with lower eyelid surgery, a limited amount of fat transfer, and then skin resurfacing.
In the theme of eyelids, this young patient, first, a lot of people see this patient picture and like, oh, that patient's so young. Why did she even have surgery? Obviously, it's a very personal decision. There's no right age or age cutoff to make this decision. You can see she had a little bit of extra skin above her eyelid. That was addressed in an upper eyelid lift or an upper eyelid blepharoplasty, and it really does open up the eyes and make them look really crisp, clean, attractive. And that's an easy procedure. That procedure can be done on its own in the office in 30 to 45 minutes under local anesthesia, similar to any dental procedure, with a little bit of oral sedation, like taking a Valium pill half an hour before you start the procedure. Or often we will combine it with a deep plane facelift and neck lift and other procedures when someone's doing kind of a full facial rejuvenation in the operative setting.
Again, this is a lower eyelid surgery and nasal surgery combined together. And the lower eyelids were addressed with that combination of lower eyelid surgery itself and also some fat grafting to help with that transition from lower eyelid to cheek junction.
This is a patient who had lower eyelid surgery as well. Just same thing, lower eyelid surgery, limited fat transfer. Beautiful result. This is a younger patient. She was in her third. She was 29, 30 years old. Some people who have a large, they have a low orbital rim. The orbital rim is the bone that sits directly beneath your lower eyelid area. If that's low, you're going to have a propensity to have that fat push forward or herniate earlier in life. And that's why that fat supplementation with fat transfer can be so important. As you can see in this case, and it creates a more heart-shaped face, adds volume in that anterior, the front part of the cheek. Izzy, you could go through them quicker just because there's so many questions. I want to get to some of them. They're great.
And we can kind of go through some of these. These are rhinoplasty outcomes. And, we've done some videos talking about nasal surgery before. I always, when I look at before and after photos, I always try and figure out whether the eyes look better in the after. I just think that's a common thing where the eyes just tend to pop when the attention of the nose goes away. But these are all just nice, soft, sort of appropriate sloping nasal profiles and 3/4 views.
Okay, we're going to get to, I know there's I see a bunch of questions for Yolanda. Before we get to that, I want to say a big thank you to our entire team for putting this event on. They did an amazing job. We would not have put on such a successful event without all of the entire team working hard, putting this together. Big props go to two very special people that put this on. It's Isabella, who's behind the scenes, moving the slides and making this happen, and Madison. For those of you that have been to the office, Isabella is director of marketing, and she does a whole host of other things in the practice. Madison runs our social media and is the ultimate team player and can hover between the front desk, the back, and is kind of the LMP cheerleader. So we are so indebted and have such gratitude for you guys putting on such a wonderful event. Next year, though, I hope to do this in person because it will be our 10-year anniversary, and we got to blow it out. Okay, so Yola, there's a couple questions for you.
Okay.
One of them was, were any implants used? No, there were no implants used. How uncomfortable was the healing process for you? Madison, can I just scroll up and down to see the rest of the questions? Yeah. Okay.
Can I say one thing about the implants?
Sure.
I think it's a good question because if you look at there's a lot of strength to your jaw.
Yeah.
And I think actually natural jawline strength can impact an outcome, right? So Yoli happens to have a really strong mandibular structure, and therefore this allows a lot of really great soft tissue contouring underneath and creating that nice shadow. Because when we think about jawlines, it's not just about this right angle, it's often about the shadow here. But this can be obstructed a little bit if someone has doesn't have as much strength of the jawline as Yoli has. So, I mean, I get the question, but this is just using her natural, skeletal structure and tissue redrape.
It was just hiding underneath all the fat.
Are you sure it
I
wasn't
wouldn't
like
say
the carrots and nuts that you're eating?
It
for lunch?
might have been.
So how uncomfortable is the healing? More fear about the surgery rather than during?
Yeah. So I would say before, obviously you're afraid. Comfort level. So a lot of people ask me, was it painful? That's not what I would explain my recovery like. It's more the tightness around your neck and jawline. That was uncomfortable for me probably for the first 3 days. It gets better and better every day. But I think that was the biggest hurdle for me, is trying to get over the fact that even though I no longer had a bandage after that first night, it's not the bandage that's causing the tightness, it's just the internal sutures, right? And so I just had to keep thinking to myself, okay, if it's tight, that means they did a great job. But that's the one thing that I had to get over. That was the hardest part. A little bit of anxiety for me, just because I am an anxious person to begin with. But that was the toughest.
Tamara has a good question. So if a patient has a first consultation and then schedules surgery for many months later, do you do another discussion / consult pre-surgery with them as a final consult to calm the nerves? In other words, a final consult to ensure the patient understands and agrees with the plan. Tamara, I'm glad you brought that up, because we are in a time, and we feel very fortunate that people are coming in for consultations in November, and the next available surgery date might be May or June, and people are calling for consultations in November, and the next consultation date is January, February, March, something like that. And that's just a testament to how wonderful our team is and what we're doing here. But absolutely, you get two. So you come in for your initial consult, whether that's done by Zoom or in person, and then when your surgery scheduled many months later, there's definitely two more kind of one mandatory visit and two visits encouraged. One is a preoperative visit. You usually meet with someone on our preoperative team. It's usually Honey or one of our wonderful medical assistants, and sometimes one of our nurses. And then a second visit to do a plan confirmation if needed. A lot of the questions get answered. It's a very thorough, it can be sometimes a anxiety-provoking visit, because we do go over all the things that we want you to watch out for, how you can prime your health leading up to surgery, what you should start, what you should stop. I think we both believe that diet's very important, and overall health is very important leading into surgery. But then you have a surgery plan confirmation meeting, usually with Dr. Lieberman and I, if that's needed, and we encourage it just to finalize the plan, hear from us one more time, ask her final questions.
So, Tamara, we have nobody in this practice has any interest in people feeling like they have nerves or anxiety without us trying to help. I think if you're going to come, our goal, if someone signs up for surgery here, is that you kind of ideally get welcome to the family of this whole practice. And we take that culture here really seriously. And who takes care of patients, who's part of this team. And, I think people take a lot of comfort in being, kind of joining the whole practice as a whole. And we want you to feel comfortable. So it's not like a transaction where we see you and then 9 months later you have surgery and that was the first time we see you. We want you to feel kind of a part of the practice the whole time, because we know how big of a decision this is.
It's a holistic, we try to think of this practice as longitudinal and holistic, right? Surgery shouldn't be where it all stops. In fact, surgery might be where it all starts for some people. And they have surgery and then they're empowered. And then all of a sudden now they are really taking care of their skin because they want to protect that investment. They feel so good about themselves that they want to kind of continue to maintain, and they'll sign up, they'll enlist a package of broadband light treatments or do Halo once a year or once a year and a half. So it can be the start of the journey, or it could be the end or the beginning of the journey, or it could be the end of the journey, but we really think about that holistic model. That's a good question, Dave. Do you want to take that Jacqueline question? and then we'll get into a little TRL.
Is there a specific age range you should be to consider a facelift if you see skin sagging that is not corrected by other means, non-surgical, and you're in your late 30s, early 40s? Would you say that it is too young? It is a great question. It comes up a lot, I feel like, and again, more and more over the years.
You don't need an ID to get a facelift.
Yeah, but ultimately, it's a really personal decision. I mean, there are people that are in their late 30s, early 40s that feel like this is the right time for them, and there are certain types of laxity that do occur early, and especially in certain skin types, that non-surgical measures will not really move the needle on. They won't help, and in fact, what you're probably doing is heating up the muscle and fat over the muscle in the neck and lower face, and causing some sort of scar tissue when without much outcome. But some people will come in and be in that age range and say, you know what, I know myself, this bugs me, I want to get this done. This is I'm really excited to move forward. And some people would come and say, no way, that's just too young for me. And neither person is right or wrong. It really just depends on what you're comfortable with. But we do see more and more people in earlier in life coming in for surgical treatment, really with the hope of, then sort of they can stop thinking about it, stop worrying about it, and also not kind of think about doing various non-surgical modalities, which, for that particular person might be less satisfying.
I'll take two facelift questions that were posted. What is the anesthesia for a deep plane facial facelift? That's a great question. We don't recommend doing it under local anesthesia. It can be done. I think it does make it more difficult to deliver a superior result if the patient's under local anesthesia. It takes about 3 hours to do the surgery, and it's going to be longer if you're under local because it's just hard to sit that still for that long. So it can be done. Usually, it's done under some form of deep sedation, like a general anesthetic, and we can work with you depending on your specific concerns and do it under conscious sedation. That can be easily done. It's similar to like when you get a colonoscopy or an endoscopy. That's what we think of when we think of conscious sedation. Technically, those are both considered general anesthesia because you're not really aware of what's happening. You can't really respond to stimuli or answer questions. So if you talk to an anesthesiologist who is using the terms by the book, conscious sedation or general anesthesia when you have a tube going down your throat or something in the back of your airway are both considered general anesthetics. And then if you've had a number of therapy treatment, does it make the deep plane facial surgery more difficult due to scar tissue? It doesn't always make it more difficult. It can. It can make the tissue a little stickier. Sometimes when we're doing our surgery, we take our tools and they glide very nicely. And then sometimes you think they're going to glide and they just get cut up and cut up and cut up. And that's what I mean by sticky. Also, all therapy has a very nice role and you can get some nice results, especially because it's no downtime. But there are studies that are showing that it probably remodels the vasculature, the blood vessels right underneath the skin, especially in the neck area where you get most common treatments there. And there's very, very, very rare cases of people having some early or heavy bruising or some like minor skin issues that have had all therapy. We've done plenty of patients that have had all therapy, had wonderful results. It might add on 5 to 15 minutes of time, and yeah.
Yeah, I mean, all therapy is offered to a very small, I think, segment of the population. It's really about choosing the right candidates. Someone had a similar question about TRL and whether it can be done in office. So TRL, tunable resurfacing laser, it's an ablative, it's our kind of big gun resurfacing laser. It can be done in office. I don't think it's very pleasant for the patient when it's done in office. We kind of encourage people to at least have some sedation on board when we're doing it, because really it's just about the experience, and we really prioritize safety in our system, in our surgery center. So we believe very strongly in that. And if you can take a rest or a snooze or whatever for 45, 60 minutes, I think it will, as you heal, the memory will be more pleasant than kind of just trying to get through it totally awake.
We have time for one more question. I'll do 2 questions real quick. Minor surgeries like a lip lift or upper lid blepharoplasty, those can be done in the office. Someone asked about both of those. I think the question is what's recommended, what type of anesthesia if money's not a factor. I think it's just totally up to the patient. Those are 2 surgeries that we can perform under local, under conscious sedation, under general anesthetic. It really just comes down to patient level and comfort. I'd say if someone's just doing that one procedure or just those 2 together, we have done those under local many times. Most people opt for that just because then cost factor and probably also, that slight hangover that you might have for a couple hours after anesthesia. And then the last question we'll take, this was a good one. Could you explain the process of creating the surgery plan? Do you bring in pictures of yourself when you were younger, or inspirational photos, or 3D imaging is used? How do you ease the fear of not knowing the outcome? It's a great question because it kind of relates to our talk. We both definitely feel that if you have pictures of yourself in your 20s, 30s, 40s, whatever age you come in, pick a few from those decades beforehand, bring them in. They help us quite a bit. We usually have them in the operating room. They help us kind of understand the intricacies of your volume and your contour and the angles that we're trying to achieve. And if we can turn back the clock or make you look like you were when you're younger, the best version of yourself now, but resemble what that youthful face of yours look like, those inspiration photos are going to help us. We don't have any 3D imaging. We have found we've looked into that technology, both Dave and I, and morphing those 3D images. It looks kind of kooky. It doesn't really give you a true marker of what a real result is. We do morph certain things in our practice. So people that are interested in a rhinoplasty or a chin implantation, we can morph that and give you a sense. It's a 2-dimensional morph, usually of 2 views, but the facelift or the eyelid surgery is something hard to morph 3-dimensional or 2-dimensional. So how do we ease the fear? We encourage you all to take time with our team before you come in for your consult. Get on the phone with Michelle or Yolanda, and they will give you all the information you need to make this decision. And then hopefully you have all that, and then just coming in, you're just put at ease when you meet with us, and we can kind of finalize that plan. And educating yourself and using the consultation or the process even before you come in for your consult as an educational opportunity.
Sounds good.
Yeah. I think this is the fun part. Yeah. Beauty bank only tonight. I can do it.
Yeah,
No, go back, Izzy.
You do it.
I like doing that. So I think it was where else can you spend $7,500 and get 10 grand worth of stuff? So those are the different tiers. Obviously the best savings comes with $10,000. I think we only offer this once a year. We always try to get Yoli to offer it more than once a year for the people that we love, and she's pretty strict. So I think you have until midnight tonight to make this happen. That beautiful website that you see where you buy this was designed by Isabella. It gives me a lot of comfort seeing it. I just love the aesthetic and what she's done with it and the colors. So those are the different levels. Sign up for $10, $5, $3, or $1,500. There's an immense savings with all of them. And you can start using it tomorrow, and you have until you have 364 days or 365 days to use it. And then last but not least, 20% off of all of our skincare. Every single item is 20% off tonight only. So stock up. I would stock up on sunscreen personally. You're going to always use that, and you're probably never going to have a sensitivity issue. You don't have to worry about the 28-day turnover that Colleen and Deanna taught me about today in terms of the retinol usage. But 20% off all skincare. You can buy it at our For the Face skincare shop. Use that promo code Fall Into Beauty, and we'll try to get it out in the mail before the end of the week. I know we have some fun raffles coming up. So the first one is the Elastin giveaway. What? I'll let David pull the number. This is the giveaway, beautifully wrapped. Here it is. I think there's a couple numbers in there. And the winner is
Heather Radford.
Heather. Woohoo! I feel like we're doing the Oscars. Okay, you're gonna keep it organized. Okay, next one. And we love Elastin. Elastin is a great complement to our TRL procedures. We use it a lot in our post procedure TRL. This is the Skin Better giveaway. I love Alpharet. That's not even in here. Oh, it is here, right there. Okay. And then there's Trio, the eye cream, the Alpha Red pads, and the fun. What do you call this thing? The little
It's Tone
compact,
Smart Compact.
a compact sunscreen.
And the winner is Cindy Devereaux. That's an amazing gift basket.
The theme of the box matches the office for those that know. Now you know. And then, is there one more?
Yep, one more.
Ooh, look at that patient getting the Moxie.
Well, that's me. I just had mine. It was actually great. I mean, and I've even gotten some pretty good compliments on my skin. So, and I'm going to do another one too. Are you ready?
And the winner is Araceli Cervantes. Congrats.
All right.
The Moxie has a $600 value. That's great. Araceli, don't do it just once. Make sure you think about doing it in a series of 3 or 6. That's how you're going to see your best results.
Okay.
Did we answer the TRL questions? Because I know that's what we're supposed to spend time on. Yeah. Okay.
Well,
Great.
thank you guys so much. And again, I want to echo what Sasha said. Thank you to this entire team, and especially Isabel and Madison. But the team is something we're all really proud of here. And thank you guys so much for joining us.
Thank you.
Bye.
Have a good night.